Welcome, everyone. Thank you so much for joining us. My name is Anna Rodney, and I am the Executive Director of Mom Cares. I want to start this session off in a little bit of a different way than I normally would start off. I would like us to have a lightning round of Ask Me Anything. So it could be I'd like you to put it into the Q&A. If you look at the bottom of your screen, there is a Q&A box. Any question you want. If you want to ask about my favorite ice cream, if you want to ask what brought me to the session, why I'm not in person, any of those questions. I want to take 2 or 3 questions just to warm up and make sure that we are active in the chat. Even though this is a virtual and it's a webinar, I thrive off of engagement because I'm a middle child and I need lots of affirmation. But we want to make sure that you have, that you feel comfortable asking questions and feel comfortable in engaging with me. So let's drop some questions. What is something fun I did this summer? Something fun that I did this summer actually hasn't happened yet. My father has a bucket list of places he wants to travel to. And so he has enlisted myself and my sons to go to some of these places. So this weekend, actually coming up, we're going to be going to Lancaster to enjoy that. So I'm very much looking forward to that. Did I make my earrings? No, I did not. I purchased them. These are actually cowrie shells. And so in the space of African spirituality, they're used in African spirituality, but also on the continent, they have been used as currency back in the day. And I have them in my hair, but I really love these earrings. So. What is my favorite savory food? A friend of mine made some very savory collard greens a couple of months ago, and I cannot get enough of them. You use coconut oil, butter, and a little bit of olive oil as the base while you're cooking them down with some bouillon, and it's the best thing ever. I don't think I'm going to eat my greens any other way from now on. And then the last question, thank you, Jennifer. The last question is, I have 2 sons, whom hopefully you won't see, but you may see. One is 7 years old. His name is Aiden. And then I've got a 16-month-old who is, his name is Asher, excuse me. That was awesome. Okay, so I want us to get in the habit and get comfortable with the Q&A and with the chat. Let's see what's in the Q&A. Kristen, I got my earrings actually from a local vendor. If I have time at the end, I can try to find her website. But I'm here in Baltimore, and so I found them at like a farmer's market. But yes. Everybody likes the earrings. I'm glad I put them in. And then especially as Tisha is asking about maternal health, what am I most passionate about? And I am most passionate about Black maternal health in particular, and then also postpartum care for families that are in the NICU. For those who are unfamiliar with my background, we'll get to that in a minute, but I founded an organization that supports Black women in particular who are navigating a high-risk pregnancy and or a NICU involvement. And my 7-year-old is actually a NICU graduate. And then for self-care, what do I do for self-care? I love yoga. I'm a yoga instructor and I love to do yoga. So that was awesome. Again, let us continue with the Q&A and with the chat. I want to hear from you. I want to talk to you. I'm going to be asking a lot of questions throughout this presentation. So let's get comfortable with that. With that, I want to welcome everyone to the Power of Words, Influencing Narratives and Outcomes with Black Birthing Bodies. Again, my name is Anna Rodney. I am a certified doula, a lactation peer educator, registered yoga instructor, Reiki master, certified mother roaster, overall maternal health advocate, and executive director of Mom Cares, which I just spoke about, and again, mother of two, whom I've already spoken about. All of this boils down to the fact that I am an intense busybody, and I'm also what you might call a crunchy mama. So today's space is, I am someone who likes to dive into hard conversations that may be uncomfortable. And so I want us to kind of go over some ground rules. Of course, I am the main one that you see, but I want to make sure that you're taking this space, taking what you need from the space. So nothing, absolutely nothing is going to be solved in an hour. A lot of this presentation is going to ask you to think and reflect and take things that you've had in your experience and connect them to other things that you might be hearing about today. Nothing is going to be fixed in an hour. None of the things that we may be talking about have taken place and created issues over the space of an hour. So we are not going to act like we're going to have any kumbaya moments and the whole world is going to be healed in just 1 hour. That's an ongoing process. If you need to step away, if there is something that is triggering, please take care of yourself and step away. Of course, I want you to stay engaged as much as possible, but if you need to step away, especially because I am not there, we're not in space. And so if you have some type of mental health need or something is triggered, I'm not there to support you. And so I want to make sure that you are taking care of yourself if you need to do that. So please step away. We'll make sure that you have my information in the chat. If you want to follow up with me and kind of talk or process, that would be wonderful, but I am not a mental health professional. No one is representative of any group of people. So just because I have an identity as a Black single mom who lives in Baltimore does not mean that every experience I have or every thought that I have or opinion I have is indicative of people that share any of those identities. And I want us to remember that even as people are populating the chat and engaging in conversation with us. While I want to make sure that you are staying safe and stepping away if you need to, challenge your discomfort. So my yoga teacher says there is a difference between discomfort and injury. If there is something that has injured you emotionally, mentally, physically, that is being triggered by something that I'm saying, by all means, take time to step away. But if you are just uncomfortable, if it doesn't feel quite right to have to listen to or engage with some of these topics, I want you to try to challenge that as much as you can to be able to lean into that discomfort. We're going to make sure that we are being respectful of each other in the chat, and we are also reflecting before we speak. Often or type, right? So we want to make sure that people feel safe, but we also want to make sure that we know exactly what we're about to say or how we're about to say it, and we know how it could possibly affect others. And we've at least taken that into consideration before we decide to share. No one is on trial here. No one is in trouble. No one has a finger being pointed at them. And also we are all learning. So even myself as a presenter, I am learning. I do not know everything, even though it does definitely probably look like I know everything and have all of the answers. I do not. And so we just want to remember that we are all learning. We are all human. So I want us to start off with a question. What can words do? When I decided to put together this presentation, I wanted to make sure that we talked about a number of different ways that words can affect us. Words can connect us and be used to connect us. They can be used to divide us. They can be used to assign us or label us. They can lift us up or they can degenerate us. In the chat, really quick, I want to hear from you. What are some words that you feel connect us? What are some connector words that might connect the 72 people that are in this room right now? What are some connectors that would bring us together and make us feel connected? Care, shared, advocates. Right, advocates, I love advocates. Trust. non-judgment, relationship, hope, change agents, community, trust, yes, love, all of these things. Absolutely. These are words that can connect us. And so as we're talking about words, we're going to come around the table of words and think of the power that words have as practitioners, whether we are advocates, whether we are caseworkers, mental health professionals, doulas, midwives, birth workers. I want us to think in terms of how our words are being heard and affected and affecting those who we are serving with, partnered with, working for. And so that is where we're at. So I'm really glad to see that we're on the same page. And so I want us to talk about a specific word and bring into an example of how words change over time and how they can have implications on the people that they are describing. So historically, words in the English language in this country have been used and manipulated to dehumanize Black people in this country, right? And so we start off very early with the N-word. I would even say before that, speaking of our brothers and sisters who are already occupying this land, referring to them as savages, things like that. And then it graduated to the N-word. And then after that, it eventually graduated to colored and Black and then African American. And now we're talking about BIPOC and persons of color. I want us to understand that while there is a constant change in language, there's a constant evolution in language, there is still a tone. There is still a tone that can be hurtful or harmful to people, regardless of what the words can be used. And so I want us to understand this. And so right now, we're in the midst of a change in language and how we use language to identify each other and support each other and refer to each other. And so we're going to talk about that in a little bit. But also, again, this is a very clear example on how words can change. We are on the succession of these words, we're talking about the same type of a person. We're talking about the same person that we would see on the street. If I'm moving through time, if I'm a time traveler, I would be called any of these things. Even, I may be dating myself, but maybe not. But my grandfather, he referred to himself and other people as colored, right? And so even in my own lifetime, I have seen the change in the move of language and how I am referred to how I am referred to as a human and how I am reflected in how I think of myself as a human. And so hearing these words, and even though these words are things that have been used or were used to identify a specific person, we also acknowledge in our language that these words are still active, some more than not. And these words, and some of these words can still cause harm, emotional harm, mental harm, right? When we talk about ACEs, we know that being exposed to adverse childhood experiences, one of those things is racism, discrimination. And so we understand that those experiences that we may have had in our childhood, or maybe we were fortunate enough not to have to integrate them into our reality until our adulthood, but these things have oppressive implications and also can either support or detract from our experience and how we are relating to other people, right? So we know this, we've already kind of said this, language is something that is alive and moving. The way that we are speaking now is not the way that we're going to be speaking in 20 to 30 years. It's not the way that we spoke 100 years ago. Things are always moving and changing. And we know that each year, 5,400 new words are created, and about 1,000 of those words make it into print and start to become part of our widespread language. So we really need to understand and dive deeply into the fact that words are not just the static thing. They are something that is alive and that we can use to color our world, to use to do those things to connect, divide, uplift, degenerate, and assign, right? And so we want to make sure that we are being cognizant of the way that the words that we're using are doing those things. Can I get a sound off in the chat? How are we doing? Good? Are you with me? Yes, 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 yes. Yay, great, great, great. Oops. So I want us to talk about the fact that there are words, especially now in the English language, that evolve and that change. And so it may be the exact same word. So I'm going to use, I know there's someone here from the DMV, so they may get a kick out of this, but I'm going to use the word dummy, right? In Baltimore, if someone says dummy, someone calls you a dummy, that can be a term of endearment, right? When I was younger, if someone told me I was a dummy or called me a dummy, that meant that I was stupid. And in other places, it can still mean stupid, right? So there are regional words, there are things that are understood by people here in Baltimore that might not be understood from someone else, somewhere else. Maybe, you know, in Chicago, where I wish we were right now, but maybe dummy does not mean the same word, same thing in Chicago. And so we want to understand that as we are monitoring our language, we are also monitoring the use of that language and what it means for those who we are using it with, especially as we're talking about the people that we are partnering with, that we are serving, beside these people that are our equals, if we're being honest, right? They're in the work that I do with Mom Cares, there is no differentiation between myself and someone that may be identified as a participant or a client. For me, I don't like using either one of those words because I feel like they do create space between the person that is supporting and the person that is in need of support. And at Mom Cares, we understand that that dynamic can switch at any point. Again, Mom Cares was something that came about as an organization that came about because I saw a gap in services when I was in the NICU, a Black single mother in the NICU, and needed support that I did not have. And so as much as the programming and things are designed to provide support, we also acknowledge that that relationship is one of equality and making sure. And so at Mom Cares, we work very hard to make sure that we are in a space of equality when we are speaking of the work that we are doing and the people that we are doing that work with. And so we want, again, just to reiterate, we want to make sure as we are monitoring our words as they evolve, we are also making sure that the people that we are working with alongside that are looking to us for support and guidance and help and understanding and compassion, right, also understand and are speaking the same language as us. So we already kind of did this one, but if we're thinking about our roles within maternal health, let's speak of some other words around words that connect us. And before we go into the chat, I want us to think about as if we are talking to someone who is coming to us for services or who is looking to us for a specific support that we provide, right? What are some words that we can share with those people that connect us, ways that I can talk to someone and they know that I am with them, that I am connecting with them as an equal, that I see them as a person and not just a data point or a participant or a client. What are some of those words that connect us to the people that we are serving or that are serving us? So saying, Asli is saying, I understand. What are some other words? And also we want to understand that language, I'm here to support you, I hear you, right? We also want to understand that language is also body language as well. Like language is not just the words that are coming out of our mouths, but the way in which we're saying, the tone in which we're saying them, right? The way in which the words that we're using, right? And so Linda is saying, I feel you, right? So when I'm talking to somebody and I need affirmation, you feel me? You understand what I'm saying? Do you hear me? Right? And so those are the words that would bring me in, or bring someone that I'm working with in, for me to understand that I am connected, that they understand me. Tisha is validate their feelings and let, everybody's moving. Hold on. Tisha says, sorry, validate their feelings and let them know that you are listening and present. And so, thank you. And also with that, going back to the nonverbal part of language, some of that means that you're just listening, right? There's no response. You're making eye contact. You're nodding your head. You're being there. You're being present. Also, a lot of us, well, I'm not going to speak for all of us. I will speak for myself. It has taken me a long time to master the fact of holding space, not fixing it, just being there. I'm seeing co-creators, partners in the work, hold their hands and look into their eyes. Oh my goodness, I miss holding people's hands and hugging them and embracing them. Yes, absolutely. So these are all wonderful ways that we are connected. There's one. So what are some words that divide us? What are some words that we hear in the work that divide us, that separate us from the people that we are supporting, or the people that we are working with or partnering in the community with? What are some of those words? I want us to kind of think about if we were in a medical setting, or if we're in a setting in which there's a provider, right? So I am the provider, I am the professional. What are some of those other words that might divide us? Expert, teacher, student, specialist, boss. Okay. Thunder, oh man, Brittany. Right? So on the surface, these words are not necessarily negative words, right? They're not words they're words that we use every day. They're words and descriptors that we use to describe the people around us that are doing the work alongside of us, right? But from those who are looking for service, for those who need a partner in compassion, is what I call it. Those words can also have negative connotations. So understanding the importance of that. I'm going to let Aiden come and say hi because that's what he wants. Quickly say hello. They can't see your face. Sit up.
Hello.
Thank you. So we want to make sure that we are thinking about doubting the client. I can't imagine blank would do XYZ. Yes. So we also want to make sure that we're not distancing ourselves. Again, a lot of our language and a lot of the things that we're talking about here today are asking us to think about and position ourselves as an equal, not in a hierarchical status of the people that we are working with and for. And so I want us to continue to think as we're moving through the presentation. I want us to think about other words that can be used to divide us, right? For example, a word that when I'm thinking about division and I'm thinking about birth, thinking about the idea of saying, oh, I had a natural birth, I had an unassisted birth. Because when you think about the idea of having a medical birth or a surgical birth, people aren't saying, oh, you didn't have a birth, you had a C-section, right? So even the word is taken out of the experience when we're talking about the difference in experiences. And so I want us to really dial into the nuances of that, because just recently we started to refer to cesareans and you know, I call them supported or intervention births, as births that were not truly births. And so even that word was absent when we started to talk about that in maternal health. So when we're talking about someone who gave birth, or someone who had a C-section, we're not saying they gave birth, right? We're saying they had a C-section. The word birth is completely erased. So let's be cognizant of that as well. And so language also assigns or labels, right? And so I think that this is the most important when we're talking about the people that we are working for, or that are coming to us and trusting us in their desire to get support from us, right? Or partner with us. And so a huge thing that has currently happened, you'll see them, you can see the in the participants in the chat, even myself, I have my pronouns there. That is a way that language has begun to evolve in the last couple of years, right? Where you're not assuming someone's pronouns. You are, and if you were, that could be an assumption that, or a label that could be harmful to someone who does not identify, right? And so if I was sitting here and I did not have the she, her pronouns under my name, and I did not identify as a she or a her, someone assuming, oh, you've got nice earrings and your hair seems to be done, or whatever it is, and assigning the fact that I identify as a she or her, could be extremely harmful to someone who does not identify. When we're talking about, especially when we're talking about those grants, in the chat, we're talking about funders. There are a couple of people that mentioned funders in the chat. And so when we're doing these grant proposals and we're responding to these RFPs, or we're doing we're looking at our data to pull out, to extract, to be able to talk about outcomes, right? Everybody wants to talk about the low income, right? Who has the least? Who is Medicaid insured, right? We're talking about that is a group of people that we are making an assumption about as a group of people. And that, honestly, and that this is another session altogether, but then we're turning around and using that data to uplift our work that may or may not be supportive truly of that person that we are assigning this label to. And so we can also talk about educated or uneducated, privileged or unprivileged. And so these are the things that we are assigning, the identities that we are assigning to people, that it's not just the identity, it is also the bias that goes along with that identity, that person now has to bear the responsibility of carrying through while we are, while we're just living our lives. Words that uplift. Let's get in the chat. I'm missing you all a little bit. What are some other words that uplift? These are a couple of words that I could think of, but even here, for some folks that didn't have a positive outcome, they might not feel that is an uplifting word. But what are some words that we use to uplift our clients, uplift our partners in the work, the people that we are serving? Strength, joy, power, confidence, resilience, identifying strengths. Yes, absolutely. Understanding and great. Yes. I like to remind the folks that I work with that we are equals. I'm going to go ahead and date myself. I know that I don't look it. And you guys can flood me with compliments after I tell you how old I am. But I am 37 years old, and I have some families who are 40, 45, 50 years old who are calling me Miss Anna. And to me, and they're not requiring me to call them Miss Brown or Miss Kiana. They're asking me, they're expecting me to call them by their first name. And so the feeling of hierarchy is there, even in their use of or insistence of using the word Miss in front of my name, right? And so I like to make sure that our families know that we are equals, and that is a word that I work very hard to incorporate into the language as I'm supporting families. And then degenerate, language that degenerates us, language that takes away or detracts from us. Here, when we're talking about maternal health, we're talking about the medical community. I'm specifically thinking about that chart, right? The chart notes that a doctor makes, that a nurse makes, that someone at intake makes, that will follow a family, that will follow a mama throughout her experience or throughout their experience. So drug seeking, non-compliant, racist, incompetent. And when I'm even talking about incompetent, the way that we talk about our body parts, right? So you have an incompetent cervix. Who wants to be told that a piece of their body is incompetent, right? That is not uplifting. That is not supportive. That is not helpful. And the way that small, minority, legal, right? I knew there were some good things happening in the chat while I was jammering. Addict, dramatic. Yes, I take that. Dramatic. Frequent flyers. I heard a Gomer. Who in the chat? If somebody has ever heard of a Gomer, I heard it yesterday. Undocumented, illegal alien. But I sit on a maternal mortality review board, and I heard the term Gomer yesterday, which is get out of my ER, right? And so we're talking about people that were referred to as this in a way that means that you're always here. And so we're talking about this in connection to the fact that people are dying. People are showing that they're going to the hospital 1, 2, 3, 4, 5 times in a row and being discharged and still dying, right? And so we really need to understand here, I really want to dig deep into the power that these words can really have in taking someone's identity away from them and degenerating them as a human and degenerating them as someone who needs our support, and can also start to create this profile using language, something that we use all day, every day, right? We use our language to communicate, to connect each other, right? To connect, to assign, to uplift, right? We're using these words every day, all day, in and out. And really what I want us to understand is the way that these words, as benign as they may be, as normal and run-of-the-mill as they may be, can really be damning, especially when there is already a bias present. For instance, there is overwhelming data that shows that doctors do not believe that Black women or Black birthing folks have their pain tolerance is higher, right? And so if I come into the hospital and I am screaming and I'm hollering and I am in pain, I am assigned as that word that I went off about, dramatic. I am being dramatic, right? That word, oh, she's being dramatic. If that word is communicated to a nurse from the prior nurse at shift change, when I am truly in pain and in need of help, that nurse is going to remember the word dramatic, and I may not get the help that I need. And again, this is reflected throughout the maternal health industry. We see these in the numbers, that these words are translating into behaviors that are then translating into tragedies and death in the Black community. Irate, miscarriage, high utilizer, geriatric. I am geriatric. If I got pregnant today, I would be geriatric, right? Who wants to feel that way when they're talking about their reproductive health or reproductive organs or their ability to carry a child, right? And so we really want to advance maternal age, yes. We could either one. I don't want to be called either one, but these words that are used to assign, but also to degenerate people, that also comes with not only just the word, but it comes with a behavior and a reaction to this word that can really affect the way I am treated or the way our families are treated. So I want to play a game really quick. Let's make sure I have time. Oh, we're doing great on time. So I want to play a game called Name That Tone. So I'm going to say a sentence, and then in the chat, I want us to say what I'm saying. Am I degenerating someone? Am I uplifting someone? Am I assigning someone? Or what am I doing? Okay. So the first one, we'll start with an easy one. Mom in room 7 is a little bit dramatic. What tone is that? What am I doing? What am I saying? Degenerating, belittling, dismissive, judgmental. Right. So then hearing that, before you go into room 7, what are you expecting? What do you feel? How are you going to act going into that room, hearing that belittling tone? And so also, if I personally am hearing, oh, she's dramatic, that means that I'm going to be working hard. She's going to run me. I need to stay away from that room because she's going to need ice and water and the rubber back. And right, I have too much on my plate. I'm going to avoid room 7, right? And again, unsympathetic, I'm seeing in the chat. May not take the mom's concerns seriously. All right. Right. We just welcomed a new little one. What is that? How does that feel? Uplifting, celebratory, exciting. Yes, exciting. Uplifting, absolutely. All right, I'm gonna throw you, we're gonna go to do one more. Oh, is this Dad? What am I doing? What's my tone there? Judgmental, assigning, judgy, assumptive, belittling his presence, judgmental. There have been many times in which I have been cis heteronormative. Thank you, Nicole. Woo! Depends on it. Iman is saying it depends on your facial expression. I would say that it doesn't depend on your facial expression. There's been a number of times in which I have been with a mama and their partner or their support person, their dad, someone else has been in the room. And that has been said, oh, is this Dad? I'm holding my brand new baby. I'm happy, I'm fresh, I am in awe of what just happened with my body. And now I have to explain to you, no, Dad is not present. This is my dad. Or no, this is my cousin. And it detracts from the space, right? So whomever is in the space deserves a congratulations. So we can't say, oh, well, I just wanted to congratulate them. No, there's a new family member. There's a new person in your sphere. There's someone important enough for you to be here in this moment, in this event. You deserve some congratulations as well, right? And so I want us to be cognizant and aware of, even if we think it's great, even if we think it's something that is positive and uplifting, how from a different perspective, like we talked about earlier, can be something completely different. It can be degenerative. Because now I'm feeling judged and now I'm feeling shamed, right? So this is where there's some work to be done. And it might get some messy if we do this directly in the chat, but if you have a piece of paper near you, I want you to write out your mission statement if you have one. If you do not have a mission statement, I want you to create a mission statement about the people that you serve, the community that you serve. And so what is a mission statement? A mission statement is something that tells us who you serve, how you serve, who and how you serve them, and what your intended benefit of them is. I will give you an example right here. So this is Mom Care's very first mission statement: serving underserved mothers recovering from poor birth outcomes. This is our actual real mission statement that we had at the beginning 6 years ago. So who are we serving? We're serving underserved mothers from what they are recovering from, what poor birth outcomes. That's what we're doing. We're helping them to recover from poor birth outcomes. We're helping moms, again, who, what are we doing, and from what? A couple minutes to jot that down. We got one in the chat. It's 2:42 where in Chicago. For me it is 3:42. So we're going to give 2 minutes to write this down. Again, it doesn't have to be perfect. I don't want it to be perfect. If it's perfect, then my presentation is over and you guys can go home. But write it out. So we're already getting some. So White Stewart says the mission statement: to protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. To protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. Thank you. 2 more minutes. I'm turning into my trainer because I say my trainer doesn't know how to count because they always add extra reps onto my thing. And I know I said 2 more minutes and it's only been 1 minute, but we're gonna move on to the next portion of this. So this is my mission statement. Here I have highlighted some of the words that could be disconcerting or could be changed or improved to connect me and the people that I'm working with in a better fashion. The word underserved, recovering, and poor, all of those words, there is a victim or there's a hierarchical assumption with these words, right? So these are the words that I am going to go back and change. So now this is our fresh, brand new, providing care for mothers navigating a traumatic birth outcome. So we just switched poor to traumatic. We are talking about navigating, so we're not assigning it to, this is what someone is doing, this is who someone is. They're moving through something that is not their fault. They're moving through something that has traumatized them, that is traumatic for them, right? We're providing care for. We're not serving, we're providing care. So I want you to, and again, our mission statement is always evolving and always changing. We're always looking for spaces to improve. So I want you to go back to your mission statement. If we want to, well, let's do this. So people have already started to do that. Promoting community health, meeting people where they are at, providing compassionate and competent care throughout the diaspora. Ooh, I like this. To be inclusive, promoting the safety and well-being of expecting families, providing, oh, yes. So so we have a couple of our missions here. Let us go back and see where we can improve, where we can change, or what we can change, if we can change. Working with moms to promote successful outcomes for mom and baby. I would ask, what is a successful outcome? What does that mean? So let's take just another couple of minutes because I want to hear from you all in our question answer portion. So let's just take another minute to see if we can improve on or change so we've got providing compassionate and confident care throughout the diaspora from Linda. And so as you're finishing, if you want to drop it in the chat, I might not get to everybody's, but if you want to drop a few of your edited mission statements in the chat, you can. Let me see them. Drop one in for me. We'll be able to hike it up a little bit, to take it to the next level. Working with moms to promote healthy pregnancies and full-term deliveries. Yes, see, yes, thank you. Thank you for that. Providing health promotion access to resources and education for pregnant women and children who are at risk for poor outcomes at delivery, postpartum, or early childhood development. I would go back to the word at risk, and again, the word poor. If you asked my opinion, which you did not, but I would go back to those. To protect, promote, and improve the health of all people, to have a positive outcome by having a healthy baby in postpartum care. Wonderful. I need to start a little tour so I can come to some of these businesses. To increase equity in health access and experiences with physical and mental health for LGBTQIA2S+ individuals. Thank you. Thank you. All right. So I want us to take a moment to reflect on, if anything, what has this discussion brought up? What has this presentation brought up for you? Has this illuminated any blind spots? Has it illuminated any space for continued learning? Has it illuminated any space for continued work? What is this bringing up for you? And even if taking me completely out of it, right? What is this topic bringing up for you? What is the need or desire that brought you to this space? And what of this discussion, what of this experience together has been cultivated in you? as I'm waiting for people to respond in the chat. Look at me. Rachel says it made me think about words and the words we use to describe families we are working with, to remember to always be aware of the words we use to describe people. Yes, absolutely. I can say a daily reflection for me is making sure that my own comfort is not centered in the way that I am showing up for the people that I say I want to show up for, right? And so I have had to slow down in the way that I speak and the way that I communicate so that I can think before I say something, because I am a number of things. But oftentimes I can say things or I didn't mean it like that, or that's not what I was trying to say, right? And so I've had to slow down my words and slow down my communication and my language to make sure that I am showing up in the way that I want to show up, and that I am communicating the way that I want to communicate for the people that I want to benefit from my experience and benefit from my presence, right? And so that has really required me to slow down. The long-lasting impact of words can have in labeling an individual. I wanted to work on my own awareness in the space with my clients. I love the discussion of language and its importance in communication. Maybe want to adjust the language you use in our trainings and presentations within my organization. I also wanted to have my own personal mission statement now. Yay! These mission statements were so good in the chat. Yes, absolutely. I will also say, slightly off topic, but not really, some piece of advice that someone gave me that has been absolutely catalytic in making sure that I am on target with my work is having an imaginary board. Who is on my board? I will tell you, Oprah is on my board. Oprah is on my board. Beyonce is on my board. Warren Buffett is on my board. We can talk about that later. But having having an imaginary board of people whose values you believe you align with, that you can check in with mentally when making decisions. So that's a little tidbit that you didn't ask for, but you got. Brittany says it made me reflect on the language I may with our partner orgs where we are the ones that provide funding. Although I may not feel like I am in a position of power as an individual, the position of power comes from the org I work for. Absolutely, thank you. Okay, so as we are wrapping up with the reflections, and you don't necessarily have to share, I am so grateful to the people in the chat who have indulged me and participated with me. I know we are at 72 folks right now. So thank you so much for people who participated in the chat, and for those who did not, because that might have been overwhelming too for me. I want to make sure that we are all staying connected. And so if you would like to connect with Mom Cares on Facebook or Instagram, you can do so. Even if you don't have the little, your phone handy, you can look for us at Mom Cares Baltimore on Facebook and on Instagram. If you put Mom Cares Baltimore anywhere, you will find us. But we're not done yet. Thank you. Yes, we are not done yet. I want, on our way out, we have 5 minutes. I want us to put in some words, because what we know today, again, we did not get through the entire breadth of everything about language, but what we know is that words have power. So I would like each of us, as many of us as possible, to populate into the chat the words that we want each of our folks to walk away with, the things that we want to sow into the people that have joined us today on this webinar. Humility. Thank you, Steve. Empowered. Awareness. Hope. Thank you, Nicole. Compassion. Accepting. Value. Empathy. Self-awareness. Love, peace, and acceptance. Beautiful. Small steps make big changes. Yes, absolutely. Authenticity, self-awareness, joy and energy, respect equals pausing and to reflect. Absolutely. Self-awareness. So as we're doing that, I am committed to using as many minutes as I can. I want to lead us. I'm going to stop sharing. I want to lead us for those who are still here. I see love and compassion, the why. I want us just to, the gift that I would like to leave each of you with is just a short breathing exercise that I give to my clients, I give to my staff, I give to myself. And so just take a moment to just focus in on your breath. If you want to close your eyes, you can absolutely do that if it's not required. But just focus in on your breath without feeling the need to change your or augment your breath. Do not perform the breath, just listen to your breath coming in and out of your body. Dial into the life energy that is moving through your body, the symphony of systems that are keeping you alive and healthy and well in this moment without you needing to think or do anything. As we're reflecting on that, I want you to breathe in deeply through your nose and out through your mouth. Breathing in deeply through your nose, out through your mouth. Knowing that in this moment, there is nothing for you to do, nowhere for you to be, no one who is expecting anything of you. The only requirement is that you be. Breathing here in this moment. Breathing in, out. Acknowledging that in this moment you are safe. In this moment, all your needs are taken care of. In this moment, there is nothing that you need that is not provided. In this moment, you do not need to be anything special, bigger than you feel. You do not need to expend any energy for anyone else but yourself in this moment. Being with yourself, breathing in and out. Breathing one last time together, breathing in and out. With that, I give my eternal gratitude for each of you who have stayed with me throughout the duration of this session. I'm going to put my email in the chat. Please reach out, connect, and thank you again for being here. I hope something that I said or did, or something that someone else, one of your other attendees said or did, leaves with you today and grows seeds of wonderfulness and abundance. Again, thank you so much for your time and your trusting of me for this space. Have a wonderful day.